Are you looking to feel better instantly? Do you feel like your shoulders are up by your ears all the time and you're constantly stressed and you would like to do something right now that will help to eliminate that? Well, then this video today is for you, because we are going to talk about the one thing that you can do to decrease your pain, decrease your stress level, your cortisol level, and get you feeling better that I promise you can do right now. I'm Dr. Amy with Physical Therapy for Everybody, and here we focus on helping people create an active, healthy, and confident lifestyle without pain medication or surgery. And I will tell you that so many of our patients are coming in right now and they're really having difficulty with neck pain, shoulder pain. A lot of them have been working from home for a couple of years now, maybe not always the best setup. Luckily, most people have gotten off their couches by now, but if you're still sitting on your couch to work from home, like, let's talk, let's get you in a better ergonomic environment. But they're just really carrying a lot of stress in their shoulders, and it's really creating problems like headaches and migraines and all kinds of different things. So the one thing that you can do right now, I promise you can do right now to help decrease your stress and anxiety, is deep breathing. And I know you have probably heard this before. Maybe you've gone to yoga and they've talked about it, or Pilates and they've talked about it, or your counselor has talked about it, or you heard a podcast talking about it. But today we're going to talk about why that's true. So I think it's really important to educate people on the reasons why those things are true, so that you know why it's so important to you, or why it should be important to you. So that's what we're going to talk about today. We're going to dive pretty deep into some things, but hopefully you'll have some good information and it will really help motivate you to focus on that deep breathing. Now, the first thing is, we are supposed to perform deep breathing all the time. That is actually how we are designed to breathe. The reason why is because we have this huge muscle that's at the base of our rib cage. It's called the diaphragm. It goes from the front of the ribs to the back of ribs, wraps all the way around, and it's huge. It's like the floor of the rib cage. It's huge and it's thick, and it is meant to help pull the ribs down and let them release so that we get oxygen into the lungs and obviously into the blood. So if we have this big muscle that's supposed to do this big job, we should probably use it. Because if we don't, what happens is we use these little muscles that are up in our neck and shoulders, and we call those the accessory muscles of respiration, which means when the big one's not working correctly, we're gonna start overusing these guys. Now, when you start overusing these guys, they're being used in a way that they're only meant to be used sometimes. So yes, they are the accessory muscles of respiration. So yes, they are supposed to help you with respiration every once in a while. But the truth is, it's like when you see a bear and you're trying to run away. That's when you're supposed to use these muscles, when you need to really increase your lung capacity and get as much oxygen as possible, because you got to go, all right? We're not supposed to use them on the daily, friends, and if you do, they get overworked, which means they get tight and you get shoulder pain and neck pain and headaches and migraines and all this stuff that's just no good, friends. Even vertigo. I've been having people come in with vertigo recently. Yeah, we do not want to be dealing with these things, okay? So we need to use the diaphragm. We need to use that big muscle because that's what it's designed for. And when we do that, it takes stress off of these accessory muscles of respiration and decreases the tone so that our shoulders are not acting like earrings, all right? Yeah, look at yourself in the mirror. If your shoulders are acting like your earrings, we've got problems. We've got to stop that. But there's more. There's a bonus feature of activating your diaphragm, and that is that when you activate your diaphragm and you use it for deep breathing, it activates the vagus nerve. Now, you may have heard of the vagus nerve. A couple years ago, it became super popular, and there's all these programs to activate and stimulate your vagus nerve. You don't need a special program, friends. You just need to do your deep breathing, because the vagus nerve goes through the diaphragm. And so when you're using your diaphragm, it's stimulating the vagus nerve. And why is that important? Well, stimulating the vagus nerve helps to decrease stress, because it decreases the cortisol. It also helps to decrease anxiety, and it helps to decrease inflammation. So if you have an injury that just doesn't seem to be healing correctly, and you're like, I still feel like my body's just not moving through this inflammation, it could be because your diaphragm's not moving correctly and your vagus nerve is not getting properly stimulated. So your vagus nerve is like your chill center. When you get it activated, your whole body calms down. It gets you out of that fight or flight response. It tells the body to just literally everything in your body to just relax and chill out. So why wouldn't you want to use the diaphragm to decrease the tone in your neck and shoulders and activate that vagus nerve to get everything to just chill out, right? It's super easy, friends, and I know you've heard this before, but I promise you, if you work on this every day and you start to make it a habit that your body actually breathes this way, you will see huge changes in your ability to deal with inflammation, in the pain that you have in your body, in the cortisol level you have going through your body. It will make a huge difference, and it is absolutely 100% free. All right? So I want you to go practice your deep breathing. If you don't know how to do it or you need some tips, there's videos on this site that you can check out. Definitely look at those. I want you to practice every day, morning and night. So usually I have people do it before they get out of bed and then right before they go to sleep, because then that way, you're laying down. That's usually how I recommend you start practicing. There's going to be some more videos coming after this one that are going to talk about how to use it when you're sitting and standing. And then in the end, what you want is actually to be performing that deep breathing all the time, because that's how you're actually supposed to breathe. It's not that you're supposed to have to tell yourself to do that deep breathing. What we want is for your body to automatically to be doing that deep breathing. And just think about that for a second. So if you were deep breathing all the time and using that diaphragm and decreasing that tone in your neck and decreasing your cortisol hormones, how much better would your day-to-day life be? How much better would you feel on a daily basis? And it is 100% free, and it's 100% within your control to be able to do this. Now, I will say the one caveat, friends, is I encourage you to remember you got to practice the deep breathing to make it a habit to deep breathing, okay? I don't want you to be like, I noticed I was really tight and stressed and I was doing my breathing up in my neck and shoulders. Okay, that happens to all of us. It happens to me. It happens to everybody. What you need to do is just say, hey, body, remember we're supposed to be using that diaphragm. Remember how we practiced that? Okay, I need you to do that. Let's practice some deep breathing right now and get yourself back in that pattern. 20 minutes later, an hour later, 2 hours later, you may find yourself out of that pattern again. And that's okay. Just gently remind your body that what we want to be doing is activating that diaphragm, because it's going to make our day better and our life better and our outlook better. All right, I hope that was helpful. If you have any questions, feel free to drop them below. It'll help us know which videos need to be made in the future. And if you would like to learn more about deep breathing, definitely click subscribe so that you're notified whenever we put out a video. Have a great day, everyone.